Good evening and welcome to Resolutions for Recovery. This month, for the past few weeks, we've really been discussing a new innovative program that has been launched in Catholic health systems, specifically right now at Good Sam Hospital, and it's the Sherpa program. So it's peer recovery coaches dealing with a person struggling with substance use disorder, whichever the substance may be, and Thomas's Hope, which is dealing with the family. And tonight I have the pleasure of having Dr. Jeff Reynolds, my buddy.
Nice to be back.
Really, yeah, you know, this program is so near and dear to my heart, because when you're the family, you're just lost. You're just lost in a big deep hole, and you have no idea how to get out of it.
Absolutely. And
Googling it, calling an 800 number, and we know what happens with that. You know, they'll send your loved one to the nearest place on a beach somewhere not in state. And the family and the interaction and the healing between the two has to occur.
Yeah,
it has to be brought back together.
You know, one of the things we were hoping in coming up with Sherpa is that families, I think often who landed in the emergency room with a loved one felt like, you know, finally, you know, they're in a place where they're going to get the help they need. It's not good to be standing in the middle of an emergency room following an overdose, but I think most families looked at it and said, well, this is better than jail.
Yes.
It's better than the alternative, and we're in a safe place. And this is going to be our springboard to treatment, to a new life, to recovery. This is where it all goes down. And so many of those families were left standing, and still are to a certain extent, were left standing in emergency departments or in parking lots saying, what do you mean you're letting him go? We got here 15 minutes ago.
And he was
How
dead.
is it that, you know, he's allowed to leave? And if you had any other condition, there's no way you'd be able to leave that quick, right? And we always liken Narcan to CPR, right? If you have heart disease, and you have an episode and you get CPR, you're going to be brought to the hospital, and a whole bunch of things are going to happen. You're going to be hooked up to a whole bunch of machines. You're probably going to be there a couple of days.
And you're going to have an awful lot of aftercare.
Right. And you're going to be moved to a cardiologist to figure out what's going on. You know, instead, they do CPR and then they send you right back home, and then wonder why the very next day they're back banging on your chest again. And that's the way we've dealt with addiction for a very long time. And so the hope is that this becomes one of those safety nets. Emergency rooms were always designed to be safety nets for people who couldn't get care elsewhere, people had an emergent issue. I would say an overdose is an emergent issue.
Yeah.
And
to say the least.
And you know, in some regards, we've criticized the emergency departments and the social work staff and the nursing staff for not doing enough. But you know, this is a disease where the patient is going to come to, wind up propelled into withdrawal and want to leave. Social work and nursing staff are already overburdened with 1,001 other patients, particularly in this day and age. And they frequently don't know how to respond effectively. And so you almost have a perfect storm there of a patient saying, I want to go, and the staff saying, all right, I think that's a terrible idea, but okay.
And here's a sheet of paper, call this in the morning.
With a discharge plan, it simply says, try to stop using heroin. And so
a little ineffective.
And we saw a number of instances where people were dead, sometimes within hours of leaving. And, you know, that's a huge missed opportunity. So anytime, you know, law enforcement or those of us that work in treatment hear about the naloxone saves, you know, we always wonder and say, so that's important, but what happened?
Where'd they go?
That's only the beginning for somebody. That's giving them their breath back, not necessarily giving them their life back. The exciting thing about Sherpa is it's one of those gaps that we identified a long time ago. It's a missed opportunity we identified a long time ago. And finally, I feel like we're starting to fill what really continues to be a giant gap. And even if you think about Sherpa, so we're in one hospital as opposed to how many are there here on Long Island. And you know, Central NASA Counseling and Guidance is doing it with Northwell. But this is one of those things that almost can't happen fast enough. You know,
it really
we know
can't
it works.
happen
We
fast
know
enough.
it's a crisis. We know it's an emergency. Why did it take us this long to figure out? Take people who have walked the road and put them bedside, and you're likely to have good outcomes. We have great outcomes, but you know, the downside of this is I always think about, well, if we had done this 5 years ago, how many lives might we have saved? A lot.
A lot. A lot. A lot. Because also when you as the family get to the hospital, and I went through this with my son, one time when I said, well, you can't stay here, you can't live in the house anymore. And I said to someone that I didn't know was in recovery, and I said, well, this certainly will bring him to his senses. And then they disclosed to me and they said, you know, when you struggle with substance use, you may think that that would be your bottom because
Right.
you don't think with that brain.
Right.
I go, but
Right.
somebody struggling, they'll dig 6, 8 feet deeper
Yeah.
before they ever come to any realization. And that's when it started, but nobody ever took the time to explain that,
Right. Right.
you know. And
Right. I mean, again, a missed opportunity. There's you know, families going to support groups requires a lot of forward motion. Very
Yeah.
often, families, you know, as you know, are busy dealing with the disease or still struggling with denial or don't know where to find support groups where
you
there are
gotta-
people healthier than them. Right?
guess
'Cause
what? You
that's
got
not always the
chaos at
case.
home.
Right.
And to
so
leave your home
yeah.
after being home, getting home from work or whatever you have
Right.
to do, and then the thought of leaving again
Right.
and not knowing what's going on in your house,
And going and
is
sitting and spending more
terrifying.
time talking about this,
Right.
right? Sometimes you
Right.
just want an escape.
You just-
So, you know, the missed opportunity not only applies to people who have suffered overdoses and people who are struggling with the disease itself, but the family members as well. And so this is a great opportunity to fix some of that. You know, we've had a lot of discussions in the state about mandated treatment following naloxone. And some of us, you know, years ago, if asked, would have said, yeah, you can't really force that. And my thinking really evolved. You know, it's kind of evolved again because with Sherpa, we've come to understand that you don't necessarily have to hold people against their will in order to get them into treatment. You just need to ask them in the right way, at the
Yes.
right time, in the right voice, right? And it can't be, do you want to go to treatment or not?
exactly.
Right? And having someone who can say, look, I was exactly where you were 4 years ago. I walked the road. I can help you with this. And if the time isn't today, here's my information because maybe the time is tomorrow. Whenever you are ready to
Whenever you're
make that
ready,
move,
right.
I'm happy to help you make it. And if you want to go to treatment right here, right now, we can make that happen. That's a very different conversation than, you know, do you want to go to treatment?
Here's a piece
yes
of
or no,
paper.
right. And
You know.
so, you know, we don't have to hold people against their will. Simply
No, we
ask
don't.
them.
You know what
Right.
and that's the amazing thing. So the statistics from the emergency room were, no one wants to go to treatment.
Right.
Quite misinformation.
The overwhelming majority
Because
now
we
are
have
saying,
98%
yes, I absolutely
that
want
want to
to
go to
Right.
treatment.
And even if you don't engage somebody now, if somebody says, yeah, no, look, I'm not ready to go, the reality is they've had a meaningful interaction. And that
Absolutely.
window can open again at some other point in time. You know, one of the areas where I do think we continue to miss the boat is two areas. I think we ought to be doing Suboxone induction in the emergency room. Because we
Absolutely.
know that reduces cravings. We know that it's hard to get inductions outside because they're cash-only businesses and people have to get there. And so
And that's a whole nother, that I do want, because that's disgraceful.
it's evidence-based. We know it works. There's no other disease where you show up at the emergency room and you don't leave with a medical intervention.
Right.
And right now, the gold standard in treating addiction is Vivitrol or Suboxone or methadone. And it's, quite frankly, the only thing we know that immediately reduces the cravings and stops overdose fatality. So that should be part of a standard of care in emergency rooms across the country.
So if JACO wrote that, the
Yeah.
Joint Commission, right, into a protocol for how overdose is handled, the emergency room would have to do that.
Yes, yes.
So
and
I know-
docs would need to get trained
Yeah.
up, and look, there are some issues around it, but you know, you've probably heard the stories too, where you have family members that, you know, are standing in the parking lot, and your loved one is saying, "I'm getting really sick," and family members who never imagined themselves going to buy heroin are doing that because you want to stop the suffering and the pain.
Of course
right?
you
And they'll
do.
bargain with you and say, "I'm going to get really sick physically. I'll go to treatment tomorrow. I just can't get sick now. Can we just do it one more time in order to make it go away?" And they honestly believe that with all their heart. Doesn't often work out that way.
I know.
But that takes that dynamic away. It takes the cravings. You know, this is, in a lot of ways, we still deal with addiction in a really barbaric, primitive kind of way. Where
It
you
really
take
is
someone who's
primitive.
about to get, you know, really, really violently ill, and you send them back home and say, drink some Gatorade, take some Advil and Imodium,
won't
and let's
die
hope for
from
the
it.
best, right?
You won't die from it,
There's
so
no other
you're
disease
okay.
that we would deal with this way. You know, the other missed opportunity is we know that if you wind up in an emergency room and you suffer a non-fatal overdose, your risk of a subsequent overdose dramatically rises, right? Because you've pushed the envelope, and we know, and
Absolutely.
you've gone big, and you've suffered this, and kind of you bounce back and do it again.
Plus all your organs.
Right.
Let's talk about,
Right.
you know.
Physiologically, psychologically, you're at higher risk. Why are people leaving emergency rooms without naloxone? Right?
I don't know.
You know, I have a son with severe food allergies,
Yeah.
right? And if we need to use the EpiPen and we show up in the emergency room, there is no way we're going to leave that emergency room without another EpiPen. That's
Correct.
not going to happen. Someone's going to check my son out. We're going to stay there for an ample period of time. We're going to make sure he's not sick. And on the way out, they're going to say, here's an EpiPen in case something happens.
Absolutely.
Again, right? We should be doing that with
Absolutely.
Narcan. And for folks that are not treatment ready, who say, I'm just not ready, or I just don't want to do it right now, there should be a conversation about how we keep you from coming back, how we keep you safe. And here's some,
Absolutely.
we hope you won't use again, but here's some naloxone just in case.
Absolutely. And maybe we buy, you know, I know the foundation bought and LICAT and FCA distributed the testing
test
for
strips,
fentanyl.
yeah, yeah.
You know, let's hand that out too.
Right.
Because
We want to give the people, we want to
gotta
give
give
people
them a
every
fighting
tool
chance.
available.
Just a fighting chance to see tomorrow.
Yeah,
They're worth that.
absolutely.
Everybody's worth that. They're
Absolutely.
struggling and suffering with a disease. They shouldn't be treated as an outcast, and
Right.
they're still being treated as an outcast. Because I did speak out for the injection sites.
Yeah.
Not that I agreed with it or disagreed with it.
Yeah.
I simply said, I think we have to open ourselves up for any new idea that could come our way.
Yeah.
If it's going to reduce overdose,
Yep.
and 10% of those people are introduced to treatment, then we've done a great job.
Yeah. I
And
mean, look,
people wrote in comments, good thing her son is dead. Like, how
Right.
does someone say that?
well, look, I mean, it
How
comes
does
from,
someone say
it comes
that?
from a basic
Ignorance.
misunderstanding. And, you know, one of the things that, and I have very mixed feelings about supervised injection
I do too.
facilities. Although I feel like there's a whole bunch of unsupervised injection facilities in public bathrooms and other places where people are dying. So, you know, and I've seen them in action. I traveled to Canada to see them in action. And I'll tell you, one of the things that bothered me, and there's a lot that actually impressed me, and they were run very professionally and I think in a very solid kind of way. And it's truly meeting somebody where they're at. But in Canada, you know, I said to a person who runs one of these sites, I said to her, you know, what's the percentage of folks that actually get into treatment as part of this? Because there is a bridge to treatment component. And she laughed. And she said, you know, getting into treatment in Canada is like winning the lottery. It just doesn't happen. And that's the part that worries me, because I never want, like, a supervised injection facility will watch you shoot up to be the best we can do.
Yeah,
Is it a bridge in time maybe to keep you alive? Yes. But I worry that government, which has been guilty of this, says, well, we'll
Yes.
just set up injection facilities, we'll just watch them and do our best. And ultimately, we know that,
And keep them out of sight.
right, we know that
Basically,
every
is
time
that
somebody
that's what
puts a
they're doing.
needle in their arm, they're strengthening and reinforcing the disease. And so
Yes.
that part worries me. Having said that, I'm a firm believer in harm reduction. I'm a firm believer in syringe exchange programs. You know, some would argue there's not a big difference between distributing clean syringes, which we're about to start doing in Nassau County, and inviting them in to use under the watchful eye of a medical professional. It's a fine line. I think we want to try anything and everything. The one thing I know for sure, and you'll agree with this, what we're doing now isn't working.
Correct.
People are dying left and right. So for all of us that think we have all the answers, we're not doing a great job.
And, you know, the insurance companies still are finding a different way to say no. They're still denying claims.
Yes.
And that has to come to I don't know, I don't understand why society, all of us, are not up in arms about paying your premiums and having co-insurance that is equal to what your insurance company pays for any procedure
Right,
that you have done.
right.
I don't know when that happened and it became okay.
Right.
Well, they post record profits.
Right. And pay for decades worth of opioids without asking a single question.
Exactly.
You know, so you help the person get into this place,
Yes.
And then do nothing to help them get out. And as we've spoken about before, that's the ultimate cost shift back to the taxpayers. Because what happens to that person? They wind up in the emergency room, they lose their insurance, Medicaid winds up footing the bill.
But parents kick their kids out and force them off their insurance to go on Medicaid.
Right.
That's
Right.
what no one else understands.
If the public understood that they all wound up carrying
Paying
the
for it
freight
anyway.
for insurance companies that didn't do their jobs, we pay for it in incarceration costs. I mean, there's so many other places that
Oh my gosh.
we pay the bills when insurance companies refuse to pay. I think if people connected those dots, they'd be more upset.
They should be more upset. But also the burden on the family, mom and dad, high blood pressure, stress, diseases, all related to this one thing, you know, other children needing psychological intervention because of what's going on at home, and or leading them down a path that may not, you know, bad attention is as good as good attention from your parents.
Absolutely. And we know that this is traumatic. We also know that there's a multi-generational aspect to this.
Yes.
I think about some of the families I've dealt with, the divorce rates are through the roof.
Oh my God.
Right? In some ways because all the chaos happened. In other cases because that person gets well and now you have to deal with each other and it's been a rough period. But the trauma that families are suffering, we don't often calculate that all out, but we know that it's happening. We know about lost productivity at work. We know about divorce rates. We know about kids that are now part of the Child Protective Services.
And never mind babies born dependent.
Right. Right.
We haven't even scratched that surface.
Well, and I worry because there we tend to focus only on the physical issues, so the actual drug dependence, and then we serve them for a period of time in NICUs and in other places. What happens when that kid is 3, 4, and 5 and there are developmental things happening, particularly in a family system that might not be completely intact?
Yeah.
And I would venture to guess that as we get through this crisis, that we will say, all right, we solved it, we'll move on to the next thing, and you'll have a whole generation of young people that will have these chronic needs, and everyone will say, we don't know why kids are struggling so much these days. Well, we're setting the stage for that now. So the same mistakes we made a dozen years ago and we ignored the onset of the problem, we're probably going to make those mistakes again because there's a whole cohort of kids that are, in fact, in some cases they're on social media watching mom and dad actually suffer overdoses as people take pictures and that kind of thing. And so what's the net impact of that? And are we going to be ready to care for these children when they're 3, 5, 7, 9, 15?
And the median age now is 10.
Right.
10 and 11 for a child to take their first drink or drug.
Right. And we're going to look at those kids and say, well, they don't just automatically have needs. Well, they do. Right.
They don't believe that statistic. But, you know, when I talk to parents and they go, you know, my kid, we're okay. They're in sports. They're not doing that heroin stuff. They just drink and smoke pot.
Right.
And they're 15, by the way. Like, are you just really that ignorant?
Right.
Because you know what? I get to say that. I earn that.
Right. Absolutely.
I absolutely earn that. And I don't mind saying it.
Right.
Because now we have science. We have the
we know more than ever before.
We know more than ever before. So you can't say, you know, 20, 30, 40 years ago, yes, it was a rite of passage. Kids drank. They didn't put vodka in a shot glass and put it in their eye or soak tampons in them and put it up. Or we didn't, that didn't happen. So bigger, better, badder, faster.
Absolutely.
That's what they want today.
Yeah.
They're not satisfied with a little bit.
Progression is a lot faster.
Oh my
gosh. I mean, the stress on kids is much faster. You know, the kid who sells your kid a dime bag understands that there's a much better profit margin than a $40 Vicodin.
Absolutely.
Right? You're going to smoke pot occasionally, but if you become a heroin user, you're probably going to use 15, 20 bags per day, which is a lot more lucrative. And you know, the dealer that's selling marijuana understands that there's a market to be made in all of this.
And so is it surprising that we find heroin mixed in with marijuana?
Yeah, you know, the economics don't work out that well, but if you can create a customer for life, then you see it happen. And, you know, we're seeing now the convergence of drugs. We tend to focus on only a drug at a time, but there was a bulletin out from Fulton County here in New York within the past couple of days about carfentanil. There was a high number, a couple dozen hospital admissions in New York City related to K2, spice, and synthetic marijuana.
That I did read, yeah.
You know, the use of Xanax is through the roof. The DEA last year confiscated more stimulants than opioids. And so, well, we're all
Adderall,
focused,
those kind of...
Well, we're all focused on heroin. There's these other things that are brewing. And, you know, it's probably time that we stop talking about the drugs and start talking about the disease.
And that's always where it should be. It really, because the disease will always be around.
Right.
The drug will be whatever it is, the name of the, you know.
And alcohol deaths last year, 88,000. Opioids was 64,000,
Yeah.
which is a lot of people. Alcohol deaths were still 88,000, still higher than anything else, and viewed as, aside from marijuana, the most harmless substance out there in the scheme of things.
It's a much longer progression to
Right.
kill yourself
Absolutely.
as an
Absolutely.
alcoholic.
Yep.
It is. But in this day and age, to have kids younger and younger and younger drinking more and more, I mean, look at all the deaths at colleges.
Right.
So now you're going to, you know, I got to get my kid prepared because they're going to drink at college, so they might as well learn this at home.
Right. Practice makes perfect.
And, you know, and then you send them away, and then you wonder why there's deaths. Now we have all the kids that are connected with that death with a
Right.
much different
Impacted.
life.
Right. Yep.
Right? They're going to jail. They're going to have a record. They have to live with the fact that somebody that they knew, they had an influence on them passing.
Right.
Wow.
Right.
That's not
trauma
something
you
that
walk around with.
I don't think I could live with that.
Right.
That's
Yeah,
crazy.
it's incredible. You know, the other discussion that's big here in New York State and nationwide is marijuana legalization. And there's a lot of discussion about marijuana legalization and marijuana policy in general. And you know, there's a lot of us who think that the historic approach to marijuana hasn't been that great. It hasn't been fact-based. We've locked people up for really low-level offenses, and when I say people,
Yeah.
I mean people of color, quite frankly, because people that look like you and I are not going to get locked up for a dime
Correct.
bag. And then you've got folks whose futures are dramatically impacted going forward. On the flip side of that, though, you have big business now entering the fray and coming in and saying, you know, marijuana is harmless. In fact, it's good for you in some cases, and looking
love
to
those
cash in
articles,
on
yeah.
this. And so, you know, we had a discussion recently with some folks at a state level. And in the state of Vermont, they basically said, you know, if you want to grow plants for your own recreational use, you can grow a certain number of plants. And I said to somebody, you know, I almost rather that, because
Yeah.
although the state doesn't get the tax money, you don't have the huge influence of big business that is going to package this in neon packaging, that's going to create edibles, that's going to wind up sending toddlers into emergency rooms. You're not going to have the push in bars and other places to actually use more, and we don't know what it does to your motor skills and motor abilities and those kinds of things. So I worry that, you know, I wish we could get the best of both worlds. I wish we could have a really smart and sane policy when it comes to marijuana that's transparent about the health risks. But I'm afraid with the influx of businesses into this space, it's going to be tobacco all over again.
Yeah,
it's going to
it
be,
is.
you know, drunk driving all over again. It's going to be all the lessons that we should have learned, you know, 40 years ago.
But we follow
We're making the same mistakes.
the
Right.
money. You know, huge tax revenues.
Right. Well, and we're told that, look, some of those taxes will be spent on treatment, but that's not the way it's worked. If you look at kind of the gaming money and the expansion of the lottery and
And
the
Lotto was
expansion
going to take
of
care of all the
casinos,
school
right.
problems.
Right.
Well,
I'm not paying fewer school taxes, are
no,
you?
and they still go up every year.
Right.
So that's a fallacy. That's, you know, medicinally, if it can help, you know, kids with seizure disorders,
Yeah.
any of those things. But that's an oil. That's
Right.
much different than recreational to get high.
Right.
The
That's
oil does
CBD
not get,
oil, right?
And that doesn't get you high.
Right. It's CBD. It tends to be non-THC. You also, I can't think of any other medication that you smoke.
Right.
So there are limitations when we talk about smoking any kind of medicine. The other problem with marijuana, and it's not the fault of activists. It's the fault of us, you know, we the community. When you look at how New York State approved medical marijuana, a whole bunch of legislators voted on it. Not a single doctor is a member of the legislature. So instead of this going through the Federal Food and Drug Administration like every other medication,
Correct.
in history, since 1940s, since the early 1940s, every medication has gone through that process. Marijuana has been treated differently, and it's been subjected to a political process. That's a disservice to all of us,
Yeah, it
because
is.
it stops effective study, it stops effective regulation. You know, if we believe this is a medicine, it ought to go through that FDA approval. And whatever barriers we need to remove at a federal level to do that, we should, so that we know that when we say to somebody, look, this might be your best hope for your child that has a seizure disorder, we should be darn sure of what we're saying, and there ought to be some science
Absolutely.
behind it, because you're putting a child's and a toddler's life
At risk.
in trusting. Yeah.
Yes.
So,
And it's still illegal for it to go over state lines.
Right.
So it can be, it's legal in New York State, whatever that means, But if you order it from someplace else, you can face charges.
Right.
So-
and we know that it's shipped all over. We know that it's filled with contaminants. Some would argue and say, the contamination issue is one of the reasons why it should be legalized and regulated. But, it doesn't come without its pitfalls. And I worry that, as we approach
the
this,
wrong
right, we're
message.
not educating people. We're not educating parents and saying, look, it's not that it's less dangerous. In fact, for some kids, some of the time, it's really dangerous and could lead to other things. But even if it doesn't lead to other things, everything we know about marijuana use, particularly in the developing brain, is disconcerting.
And there's a lot of kids at outreach right now
Yes.
that have a severe problem with marijuana use.
Yes. Yes. And the problem is not in the kids that are thrill seekers. The problem really is in the kids who smoke a joint and say, I didn't get high, I just felt less anxious. I felt like I fit in a little bit better. I didn't feel as stressed out. I feel like it leveled out my mood, right? And if you feel that when you smoke pot, it's going to be hard for me to talk you out of smoking pot because everybody wants to feel good, right? Everybody wants to feel leveled out.
Especially these poor teenagers.
Right.
They really are
Right.
at the end of their
More
rope.
stressed than ever before.
they're-
And in a lot of cases, mom and dad are smoking pot, so why wouldn't you? Right? And kids will say, well, it's pretty much legal. You smell it everywhere you go.
I was in the city Saturday, and I was like, wow, right there on the corner,
Right.
smoking a big fat blunt.
Right.
And I'm like, right out in public, not even on the side, not even anything, just walking down like nothing's
See,
going
those
on.
are some of the things that we have to change. There's a Clean Air Act out there which says you can't smoke in a whole bunch of places, you can't vape in a whole bunch of places, you're not supposed to be drinking on the street.
Right.
Marijuana should have the same rules applied to
Absolutely.
it.
So we'll be right back. We'll be right back after this message.
My age is 18 years old and my name is Evan.
My name is Sean and I'm 19 years old.
My name is Justin, I'm 16.
My name is Angelica. I'm 18 years old.
Marijuana, and I was 13 years old.
Marijuana, and my age was 13.
The first drug I ever tried was marijuana, and I was 12 years old.
It was marijuana and I was 11 years old.
Yes, and that escalated to promethazine, lean.
I began to take pills like Xanax, Percocets.
I began using other substances such as pills and alcohol.
I then went on to cocaine and pills and quickly progressed to heroin. I was 13 years old when I first started using heroin. I had aspirations of going to an Ivy League school, and that quickly, within a year or two, changed. I stopped going to my classes, I stopped going to school altogether eventually. All my friends were kind of just dropping me.
I started getting in trouble in school, eventually kicked out. I got in trouble with the law a lot.
I wasn't really hanging out with a lot of sober people, just people that use. I overdosed at 15. I've been at Outreach for 5 months. Outreach honestly really helps you. It shows that you're honestly worth something. And it's possible to become sober if you put in progress. But it's not just gonna be handed to you, you really have to want to change. Inpatient, you can't just leave. You stay here and you have to deal with it. That's what I feel like a lot of kids need.
In a long-term facility, the counselors get to know the resident better, and they get to actually work with them more than in a short-term 28-day facility. And it really gives kids a chance to work on themselves rather than being rushed through a program, just to be thrown back into life, going back into the same old bad habits that they were doing before.
Coming in here, I couldn't believe how long I would have to be here, but after a couple months, talking to counselors, I kind of came to the realization that I need a lot of time and work to repair everything I've done.
The things that we get taught here, it really does help you in life, and it gives you a different perspective. It's very important for a kid to have a family involvement in treatment so they don't think they're alone in this. We communicate on a better basis than how we used to. We understand each other more. and that was from the help of outreach.
They come every Wednesday night for support group. They come to a group every other week.
They come to parent support group to discuss their problems also. My relationship honestly has gotten a lot better. Because I remember my mom used to never want to say anything to me because she would be scared of my reaction. I'm starting to realize in here, like, I really have to take advantage of the fact that I have her still.
When I was about 14 is when my parents realized that I had several different problems, such as behavioral issues, and the behavioral issues kind of stemmed from my drug use. I began caring less about myself and others. Outreach has really made me realize how important family is. If I was out of state in a program where my parents were not involved, I would have never been able to strengthen my relationship with them. My father told me that I've inspired him to make changes in his life, and that meant a lot to me. I've never heard my dad be inspired by something before, and I was just proud that it was me.
Hi, and welcome back to Resolutions for Recovery. You know, so how old is Brooke now? 10? 11.
Yeah.
So really, statistic-wise, when you look at your daughter,
Yeah.
she should be doing something already.
Yeah. You know that.
How does that make you feel, though, when you look at her?
You know, that entry into middle school is really, and for me it was junior high, is really a tricky time. And I've told the story.
Frightening.
Told the story before where, you know, I went into 7th grade as a kid, and within 20 minutes of being in 7th grade, somebody handed me a cigarette in the boys' bathroom. I smoked it. The first time I had ever done that. A teacher walked in, and I was suspended for 3 days. Right. So I was in 7th grade literally for 20 minutes, no joke,
And
before I was smoking and suspended. Right, and you know, kind of the geeky 6th grader, that jump is really significant. And I think,
Huge.
you know, in my house, obviously, given what I do, there's a lot of discussion about drugs and alcohol, you know, not about heroin needles per se.
Right.
But my kids know, and there is a discussion about, you know, you use medicine when you're sick, you communicate with your parents. Yes, we're around folks who drink alcohol, but we have a conversation around that. But it's a scary time because that age of onset of use continues to drop precipitously, yet there's more and more evidence that says if we can postpone that onset of use to 18, the results are dramatic. You know, every time I do an educational program, and it's about, and we did one last night, it's about talking with your kids about drugs, you know, I almost feel disappointed that the rooms aren't full, because when we talk about addiction, it's a serious relapsing condition that for some people will be a fatal condition. I can't think of many other instances where you could give parents a piece of advice that would lessen the likelihood their kid would develop a serious, potentially fatal illness. You know, and so I can tell you exactly how to do that. If I made up a flyer that said, learn how to prevent your kid from dying of a preventable illness, you know, by a factor of 5, you know, the room would be packed if I said
Correct.
It was cancer or something else like that. And so this is the same thing. And, you know, for kids who struggle with mental health disorders, it's a matter of getting in there and diagnosing and treating. For the kids that don't, it's a matter of reinforcing those prevention messages at every turn. And I don't know that happens in a lot of households. I know it doesn't happen in school districts, and I know it doesn't happen in communities to the extent that it should.
It's still mind-boggling to me. So, you know, my daughter, through all the craziness, also had a baby at 19. Mm-hmm. So my Vincent is now 10. Mm-hmm. And to have the discussion now, he remembers his Uncle Thomas. And what I told him at 4 and the discussion that we have now, very two different discussions. Right. Age appropriate for sure. But am I keeping a really even more watchful eye on him? Without a doubt.
Absolutely.
But today I went to his little 5th grade graduation or whatever, and I'm looking at these babies going,
right.
Oh my God,
yes.
I wonder what's going on in their minds right now.
Yeah.
Because I know that there are kids in there doing things.
Yeah.
And it's just
and you know, it's
disconcerting to say the least.
There's a line too, because we know that in order for kids to mature and grow, they need to try certain things and have certain experiences, right?
They're going to make mistakes.
Right. And I'm not talking about just try certain drugs, but our kids need to experiment and kind of test the balance, and that's how you become a responsible adult.
Absolutely.
Right? You try something, it doesn't work out, you pay the price, you learn your lessons, and you dial it back, or it works out really well and you become a little bit more confident and bolder, and trying those things out is really important. So you want to have these conversations in a way that doesn't kill that experimentation completely.
They need to push out of their box.
Right, right.
You know, they got to expand their boundaries a little bit.
Right.
You know, and you don't want to, you're right. You know, a lot of parents also stop the mistake because
Right.
they don't want their kids to fail. Failure is how you learn.
That's part of the drill.
That's
part of the drill. And,
you know,
and honestly, you know, again, and you know this, it's a fine line between, you know, putting so much pressure and controlling the conversation versus not. You know, there's no right answers. I said to a group of parents last night, there's no right answers here. I can't teach you how to parent your kid. What I can talk to you about is the need to speak from the heart, to keep the lines of communication open, to trust your intuition and your gut, and to use your influence. And, you know, God
So-
knows you're not your kid's friend.
No,
Stop
you're
acting like it.
Exactly. So Suffolk County Legislature came out yesterday, and I spoke to Channel 2 News because they're handing out alcohol testing kits and drug testing kits. So the question was, well, would you tell parents, yes,
Yeah.
test them?
Yeah.
First off, you know, as a parent, we all know when something's not quite right.
Yeah.
You have that little, your antennas go up. You should be waiting home for your kid, waiting up for them when they walk in the door.
Absolutely.
And why not test them?
Right.
Not every time, but when they don't know what you're going to do,
Right.
it keeps them a little bit more honest.
It does. And, you know, for a lot of kids, you know, I prefer, at least with my kids, that if they're not going to drink or use drugs, that they say, yeah, I don't do that, and I don't know why you are either.
Right.
But absent that kind of bold statement because of peer pressure or whatever else, or insecurity, you know, a kid's ability to say, yeah, I can't do it, my parents test me, gives them the perfect out. That's what we call contingency
Absolutely.
planning. Right? So the
Yes.
kid that walks around with an empty red Solo cup so they fit in, I wish they would take a stand, but not every kid does, and quite frankly, neither does every adult, right? We've all been in
Correct.
situations where we look and say,
Absolutely.
boy, I wish I had said something. But you
Right.
don't. So in the meantime, you know, can we help you come up with a plan that keeps you safe and enables you to navigate really difficult waters when it comes to peer pressure?
But if parents were to get off their phones too
Right.
and engage with some of their kids' friends, you're going to find that the other parents feel the same way that you do.
Right.
And are unequipped and maybe, you know, unable to also give the. But if 4 of you come together and say, hey, the 4 of you go out and the 4 of you say, we don't do that. Our parents are testing us when we get home.
Right. Well, and the same goes for allowing children to drink in your house, right? How many times do we hear, well, it's safer if they do it under, they're going to do it anyway, so it's safer if they do it under my roof. I always ask parents, you know, would you let your kid juggle chainsaws in the house? It'd be safer than doing it in the street, right? No,
Right.
of course not. Why? Well, because it's dangerous. I always ask dads, do you feel that if you have a daughter, do you feel that way about sex in your house? Is it okay if your 14-year-old has sex as long as it's under your roof? And they're mortified and say, no, absolutely not. Well, how come? Well, because sex is a very mature decision. It comes with potential health complications. It comes
Oh,
with psychological
yes.
complications, right? It's something that you should be older when you make those kind of decisions in order to make the right decisions that sometimes you can't undo. Well, bingo.
Yeah,
You
thank
just
you.
made the case, besides the legal kind of piece of that, where if a kid consumes alcohol in your house and then something happens
Social
to them.
host
right.
law, so that, you know, there is a law around it.
But if we
But it
all stood
should- it
firm
should just
and
be-
said, no, underage drinking is not okay. This is the law. Maybe you could go off to war at 18, but the law says 21, and we're going to follow the law. And the law's in place for a really good reason, given what we know about the developing brain.
Absolutely.
If all the parents took the same stand, we wouldn't have half the problems we have.
No, we wouldn't.
But somebody always wants to be the cool parent.
Exactly, but they
difficulty.
should be the minority.
Right.
But it also should be, you know, you've seen it, I'm sure, in your neighborhood. Halloween shouldn't be that the parents are
Yeah.
pulling a red wagon
Yeah.
that's not filled with babies, that it's filled with a cooler, and they're
Right.
walking the streets with red cups.
Because we can't go for an hour without
That-
having a drink.
And, you know, last year brought the babies to see Santa with the Santa train, you know, in all the communities. And people can't come out for 15 minutes without bringing beer and drinks. And
Right.
I'm like, really? You have your kids here. You're seeing Santa.
Right.
And you're lit.
Well, and then back to the marijuana conversation, you wonder if 10 years from now, you know, people walking around with bongs and smoking joints at the same time they're drinking their beer.
Right?
Right.
Because it's going to be okay to do that.
Right.
So what world are we creating for our kids? What's the message?
Right.
Escape at all costs is really
we know,
the
and
message
you know,
for me.
our friend Kim Lauby says it very well, that our kids do what we do, right? They watch what we do very carefully.
Yes.
The things we say go in one ear and out the other, but they watch very closely what we do. And so you say to your kids, well, look, don't drink, but you know, it's your go-to after a stressful day where you need to take a Xanax in order to get on a plane, and you make a big show of it, then, you know, our kids are hearing one thing from you, but they're seeing another
Absolutely.
thing. And our kids look up to us.
Yeah.
Even if we're not the best parents in the world, we're the primary mover when it comes to influencing their
Absolutely.
behavior. Not the 14-year-old down the block, quite frankly. It's parents, and kids look to us.
Especially at 9, 10, 11,
Right.
12.
They look
So
for cues,
as
right?
the age of onset comes down, how do you show up at home?
Right.
If every day you come home and say, I need a glass of wine, I had a terrible day. If every day you say that, is it a surprise that your 10-year-old comes home and said, well, I had a bad day.
Right.
I'm going to do what mom and dad do.
Right.
Because that's what's happening in today's world. It's not a surprise.
Right.
We all check out. And that's just not good. Imagine if parents came home and said, I had a really bad day. Let's just get the blankets out, make a fort, watch a movie. I just need to be with my family.
Right.
Wow, what a different message. We're safe. I'm home. We're good. Let's eat popcorn and watch a movie.
You know, I think we're probably headed for a point in American life where we start to think more that way. If you look at
I
what
hope
schools
so.
are doing, schools are integrating more mindfulness into the things
Yes.
they're doing. There's a superintendent in Patrick Medford, who I'm very fond of, who just doubled the recess period of time, right? He went against the grain, and he's a big opt-out proponent. And regardless of how you feel about that, he said, you know, we're going to double the amount of recess the kids get, because kids need that kind of release.
They don't have
They need that kind of
ADHD.
expression. They
They
need
need
to
to
do that.
run.
Right. And so, you know, I think we're beginning to see a backlash. I hope we see more of a backlash around technology and an
I hope
understanding
so.
that, you know, face-to-face time is
Yeah.
as important as FaceTime.
Yes.
You know, and, you know, we've long talked about how, you know, at least one meal together as a family makes a big difference. And
Yeah.
it's simplistic, and that's not to say that addiction is caused by not having dinner together, but we know that there's a whole host of protective factors that
Yeah.
make a difference. And quality family time where you really listen to each other can go a long way. Is it the only thing that's going to make a difference in terms of whether your kid develops a substance use disorder or not? No.
No, but
But we line up a whole bunch
Yeah.
of risk factors and protective factors, and those family relationships and that family time is one of those protective factors.
Absolutely.
And don't you want to increase the odds any way you can as your kid grows up?
any way that you can.
Right. Any little advantage
Any
you can get.
advantage that you can
Right,
get.
you wanna find
Our
it.
friend Tim Sinney, though, who has really younger kids, said that he feels his group of parents with those younger kids, they're allowing them to ride their bikes and fall off their bikes, and it's okay.
Yeah.
He said he thinks that the pendulum is swinging a little bit back with the parents coming up. Maybe they've seen the helicopter parents. Gee, that's not working either.
Right.
So let's go back to, you know, not being their friend.
Right. Well, and parents looking out for other people's kids. You know, when I was a kid, if a neighbor saw us doing something wrong,
You were in
we
trouble.
got marched home, right?
Yep.
And there was, you know, your parent wasn't yelling at the other parent for coming and blowing you up. There was a
Absolutely.
conversation. These days, I think people just kind of go about their own
They're
business,
intimidated.
right? And are afraid that
Yeah.
if I bring your kid up to the step and say, this is what your child did, there's going to be a big fight.
But you know, I always tell parents, I said, you know, if you say something to your neighbor or another parent and they get mad at you, don't worry about that reaction. Look at yourself in the mirror. And if you saw what you saw, can you live with the fact that you didn't do something for
Right.
that child? That's the question that you have to ask. Because once it's said, whether the parent's mad or not, the seed's been planted.
Absolutely.
And that's all you really need to have happen,
Right.
because they can't help but look at their kid differently.
Right.
It's done. They're going
Right.
to start to notice other behaviors and other things, and do it. Let
Yeah,
them be mad.
yeah.
Who really cares?
You know, we're heading into the summer months, and that's typically the time when things are the worst in
Yeah.
the stuff we deal with. So we see a big upswing in alcohol use, marijuana use. You know, last year, if you remember, there was a huge police bulletin about a huge number of overdoses in a very short amount of time. And so people are out more They're engaged in more activities.
Listen, parents are working and kids are home. So,
Right.
so young teenagers that maybe are not going to camp because camp is really expensive.
Yes.
And with two working parents, you can't stay home. And they're old enough to be by themselves and they're not old enough to be by themselves.
Right.
They're in that quandary.
So we're heading into some difficult months. You know, it's really important that
Check your
we get
kid's
the
backpack.
check their cell phone. You know, parents will say, you know, well, what about the
that's
right
their
to privacy
privacy.
and that kind of thing?
There is
And,
no privacy.
You know, those days are over. I think, you know, this has become, you know, a life and death scenario.
Well, first off, a 10-year-old, 12-year-old, 15-year-old, if I'm paying the bill,
right,
I have every expectation that I'm going to look at what's on your phone,
right.
whether you want me to or not.
Well, and look, we all work in places where your employer says, I could look at your computer anytime, right? We routinely, you know, at FCA, we don't spend time going through people's computers, but there's software on there that if we think there's a problem and you're not doing your work or you're looking, we have the ability, we're paying you.
Absolutely.
We have the ability at any point in time to open it up and take a look and see what you were doing.
Absolutely.
If you could do that in the workplace, do we think for a second you should be able to do that within your family when your kid's life is at stake? That's crazy.
It's crazy.
Great. So I always say to parents, you know, you should be alert and looking around and, you know, as you said, up when your kids get home. You should be, you know, around the house, surprise visits when they don't expect you because you want to see
Absolutely.
what's going on. I
You
mean, this
you
is-
want to know what's going on.
There's a lot at stake.
And if they bring their backpack out and put it on the side of the house and leave without it and pick it up,
right.
well, I'd be damn sure that I'm looking in that backpack.
Absolutely.
You know, that's it. It's simple things like that. You're not their friend.
Right.
I don't know how else to say that. No, it's those are all the really difficult conversations to have. You still have to have them.
Yeah, and on an ongoing basis. And again, I think you want to do it in a way that
They don't have to be argumentative.
right. And it really should be, look, my number one job, it's not that I don't trust you. My number one job, and in fact, my only job as a parent is to keep you healthy and safe. That's the only thing that matters to me. And that means
Yes.
at a very base level, whether it's conscious or not, I'm going to do whatever it takes to keep you there. And if I suspect something's going awry, there's something that kicks in automatically in me as a parent. It's going to set
Yes.
off a whole chain of events. Some of it is conscious, some of it's not, but I'm going to protect you.
Well, your daughter is probably coming into the time when there's sleepovers.
Yes.
So, you know, I know especially with my daughter, I was much happier having 10 girls sleep at my house. Not that that was a happy thing,
Right.
but if I didn't know where they were going, I had a really hard time letting her go.
Yeah, we don't do that unless we know the parents. But I'll tell you, I'm shocked, and I've said this to people before, I'm shocked at how many parents will come and leave their kids at my house having never met me. And look, a 5-minute interaction in the doorway doesn't necessarily tell you all that much, but at least you could do a pretty quick assessment and kind of figure out.
You know what? There's that gut feeling
Right.
that you always have.
Right.
I remember dropping my kids off for a pool party, and when I went in the backyard, and all the adults were very inebriated.
Right, right,
And I said, I'm going to leave you guys here at a pool party? Not.
right.
So I stayed for a little bit, and then I said, oh, we have another party to go to. Were they mad? Yeah, my kids were mad.
Right.
But I couldn't leave them there because accidents happen. That
Right,
was the
right.
perfect storm for something to happen.
You know, we have parents that, and we do pool parties for the kids, and we always hire a lifeguard because although I can fish a kid out of the water, like, you don't want to take that chance. And so we
No.
always say to parents, and we hired a professional lifeguard. Here's who the person sitting
Yeah.
right there. They're doing nothing but watching the kids. Yes, if something happens, I'm pretty good at this and I can help. But we've hired someone whose job is to do nothing but
Because you
keep
know
people
what?
safe.
If I'm making a hamburger and I turn for
Right,
25 seconds and something happens,
Right.
I don't want to live with that.
But again, I'm amazed at how many parents will drop their kids off. Now, look, in some cases, parents know what I do, so they kind of figure, well, he's probably pretty safe, right?
Yeah.
But there's a number of parents that don't necessarily know that, that'll just drop their kids off for hours at a time. And it's difficult because you see, particularly as kids hit the age of 10, 11, and 12, you know, some mean girl stuff begins to kick in and the cliques begin to form. And either you're at this party or you're not at this party. And as much as you say to your child, it all doesn't matter. They don't
It
necessarily
matters.
get that, right? It matters deeply at this point in
Yes,
time,
it
right?
does.
Your
It
world
hurts.
will stop spinning on
Yeah.
its axis if something goes awry. And so, it's difficult to navigate. How do I keep enough control so that I'm not limiting your social interactions, which causes other problems, stress and anxiety?
Does Brooke have a cell phone?
She does not. She does
Okay.
not.
Is
She
that
has an
an issue?
iPod that has no phone service, that kind of thing. Yeah, it's an issue because a lot of her friends do. And I'll tell you, one of the things that really tipped the balance for us was at a pool party a year ago where she had some friends that did nothing but take bathing suit selfies and spend the entire time on their phone. And for me, it was like, that's it. This is not happening this way. And there's a group of parents that are along the same lines, and we talk about it regularly because we know that as one or two give in, then it's going to begin to shift. At this age, we're getting to the point of, is there a safety concern here, and when does it become an instrument for safety versus something else? We're probably on that cusp, but so far we've resisted it.
But you can get her a flip phone. She doesn't need access
Right,
to the
right.
internet.
We've put that on the table. And
She's probably mortified on that, but
But look, again, my job is not to be your friend and not to win a popularity contest. But we've had instances where other children on her bus have taken videos of her, pictures of her, and we've had to call the parents and say, do you know that they're doing this? And the parents are mortified. They're like, that's not what I got them the phone for.
Right.
It was in the event that they needed to call me for a pickup from school or something else. So it's not always that easy. I also worry because, I have a younger one, a son as well, and the gaming, video gaming, that kind of thing. And so,
and that's a whole nother addiction.
right, right. But
So-
again, it's creating these false worlds at a time when you should be figuring out your way in the real world.
Yes.
Right? So there's bad stuff that happens to you in video gaming and interactions with other people, that kind of thing. But you learn between those ages of 7 and 15 how to interact with other people, how to have uncomfortable conversations, how to face rejection, how to open up to another person, how to do active listening. That's where you learn all that. And if your face is buried in a phone, then you're not learning those
Or
skills.
buried in a PS3,
Right.
an Xbox, any of those things.
Right.
I worked with the SAPIS, all the substance abuse counselors in the city the other day, and there's 350 that actually work with 400,000 kids, and them talking about, never mind drugs and alcohol, we have gaming addictions.
Yeah.
And they're big time.
Yeah. Well, process addictions, I think, are finally coming to the
Yeah.
forefront. When you think about the expansion of casino gaming, there's now a casino in, pretty much every part of the country.
Absolutely.
And at least one here on Long Island. When you think about sex addiction, certainly a big issue. Video gaming. Look, there's any number of things that you could become addicted to, particularly in this culture, particularly if there's a business that's driving you to want
Yes.
to use more. And if you think about the video gaming business, it's huge. It's as big as the marijuana industry, if not bigger.
Absolutely.
And so they've got an impetus to kind of keep you engaged in that game. And look, there's nothing wrong with gaming. In fact, some would say that there is a potential health benefit from moderate use, like anything else, right?
Moderate use,
Moderate
but that's
use
the
in
key.
terms of reflexes and that kind of thing. But the rapid fire screen changes, the violence that's part of some of the
Yeah.
games, and the fact that kids are doing this for many hours per day, which causes
No.
obesity, ADHD, any number of things, is not healthy.
Right.
So again, it's, be a parent. Your kid shouldn't be using a computer if you're not in a room. If they're not old enough, you should have content filtering on there. There are a number of apps that'll limit the gaming opportunities. If,
Yes.
if you're too much of a chicken to say to your kid, it's been 2 hours, it's time to shut it off, there are apps that'll do that for you.
Yeah.
And say, it's now 2 hours, we're locking this down, see you tomorrow.
But guess what? Them yelling at you shouldn't be the reason that you don't
Right.
disengage them
Right.
from doing it.
Right.
I don't know when we stopped. I know certainly if I said to my father, "No, I'm not stopping,"
Right.
I would have been
Right.
I would have been locked up.
Right. Computer
for-
would be gone. Right.
Yeah, oh,
Right.
I would have been gone.
Right.
That wasn't even an option
Right.
to have that kind of thing happen. It always makes me crazy that parents don't have a plan yet for the summer, that they're not even thinking about. Yes, it should be a carefree time for kids. It should be all of those things. It should be the best time of their life. But you need to have some kind of a plan.
Yeah.
And you should be having those difficult conversations right now.
And look, there should be some learning that happens. Summer's supposed to be for fun and carefree and that kind of thing,
Yes.
but there's a significant amount of learning loss that happens with kids over the summer
Big
because
time.
it goes from a huge amount of pressure, study, to nothing for a
Yeah.
couple months, and then you're back into the game. think we got to flatten that out a little bit. You know,
Yeah.
double the recess period, but maybe have kids engage in some academic activities during the summer, even if
Reading
it's
for
pleasure
fun.
reading, right?
Right.
Because you don't want that summer loss to happen. So,
Correct.
you know, look, there's a conversation to be had about why we have summer recess period,
Yes.
right? We've had air conditioning in schools now, or the ability to put air conditioning in schools now for 100 years.
Yeah.
You know, clearly teachers like their summers off, but increasingly there's a conversation about, you know, is the school day too early? Is it too long? Does it make sense to have summers off? And we probably are ripe to have a conversation in this country about how we actually educate kids and who educates them and what the day looks like and what the activities look like and what's really important in the scheme of things.
I think that the school should produce a healthy young person willing to move on to trade school, apprenticeship, college, whatever their choice is, but the key should be a young, well-adjusted adult on their way into, the world.
Absolutely.
And not all this pressure at the age of 12. I mean, right now you should really be bullying Brooke into what are your ACT scores going to look like? What's
Right.
your SAT scores going to? And we have to really get prepared now. Your grades
Right.
better. You better kick this up.
Right.
That's what we're doing to our kids, and
Absolutely.
they're losing their minds.
Right.
It's not healthy in any way, shape, or form, which leads us back to how did we end up in this crisis?
Yeah.
Why are they looking to escape the world that they're in? And that's something for all of us to answer that question.
Absolutely.
And you can't say, not my kid anymore.
Well, the crisis is proof positive of a lot of things. I only hope that as we've experienced the horrible wreckage of this crisis, that we pick some lessons out of it and say, here's what we learned. Here are the mistakes that we'll never make again.
It should be, why not my kid? And when a child in your community succumbs to the disease, that's your kid too.
Absolutely.
That's how we should be looking to it. It may, by the grace of God, it's not in your house, but it shouldn't be in the next door neighbor's house
Right.
either, or down the block. It shouldn't be that, because if we had a disease, cancer, or anything else, we embrace that family in a community. We need to embrace all these families now across Long Island.
Absolutely.
And thankfully, we're doing that now. Hopefully, we'll be moving into, I think St. Cat's is going to be next.
Yeah, I think St.
And
Catherine's is the next
think
hospital.
I actually told them in our meeting the other day, there's a lot of in-service education that has to happen in that hospital.
Yeah.
That hospital's totally different than Good Sam. And I'll say that in my outside voice because I have personal experience.
Yeah, and look, I think hospital systems generally understand the need to do something. I think, there's a distance from point A to point B because these are still the most difficult patients in a lot of regards. It's still a disease that carries incredible stigma. And for almost anybody across the board, you've had personal experiences with addiction, and they're generally not pleasant. Right? Addiction doesn't always bring out the best in people, and so we've got to find a way to convert our personal experience not into hopelessness, but into hope.
Yeah. Thank you so much, Jeff.
My pleasure. It's always a great conversation.
We're going to have Jeff back on because we actually are going to have a lot of more bigger plans in the near future that we're going to do together. It's going to be very exciting. I'm ready to hit the ground running. Have a great Memorial Day weekend. Stay safe. Don't drink and drive. Don't drug and drive. And keep an eye on your kids. Take care.